If you're a man over 50 dealing with frequent nighttime bathroom trips, a weak urine stream, or that frustrating feeling that your bladder never completely empties, I want you to pay very close attention to what I'm about to share with you today, because there's one specific exercise that most urologists don't tell their patients about that can dramatically reduce prostate size and eliminate these symptoms without medication or surgery. I'm Dr. James Whittaker, a board-certified urologist and general physician with over 20 years of clinical experience. And in today's video, I'm going to reveal the number one exercise that can actually shrink and enlarge prostate naturally. And I'm going to show you exactly how to perform this exercise correctly, because most men do it completely wrong, which is why they don't see results. Before we dive into this life-changing information, make sure you hit that subscribe button and turn on notifications so you never miss any of my evidence-based health content. And I want you to do something else for me right now. Drop a comment below and let me know what country you're watching from, because I love seeing how this information reaches men all around the world who are looking for natural solutions to their prostate problems. Let me tell you about Richard, a 62-year-old retired accountant who came into my office about 18 months ago, absolutely exhausted and frustrated. Richard told me he was getting up 5 to 7 times every single night to urinate. His sleep was completely destroyed. His relationship with his wife was suffering because he was irritable and tired all the time. And he was starting to avoid social situations because he always needed to know where the nearest bathroom was located. Richard had been diagnosed with benign prostatic hyperplasia, or BPH, which is the medical term for an enlarged prostate, and his prostate had grown to about 60 grams, which is more than double the normal size. His urologist had recommended starting medication, specifically an alpha blocker to relax the prostate muscle and a 5-alpha reductase inhibitor to shrink the prostate over time. But Richard was concerned about the side effects he'd read about, including sexual dysfunction, dizziness, and the fact that these medications would need to be taken for the rest of his life. He asked me if there was anything else he could try before committing to pharmaceutical intervention, and that's when I told him about the exercise I'm going to teach you today. Richard was skeptical at first because he'd never heard any of his doctors mention this approach, but he was desperate enough to try anything. So I spent about 20 minutes teaching him the proper technique and explaining exactly why this exercise works on a physiological level. Now, here's what most men don't understand about prostate enlargement and why this particular exercise is so incredibly effective. Your prostate gland sits right below your bladder and surrounds your urethra, which is the tube that carries urine out of your body. And as your prostate enlarges with age, it literally squeezes this tube like a hand around a garden hose, which is why you experience weak flow, incomplete emptying, and that urgent need to urinate frequently. The conventional medical approach focuses on either relaxing the smooth muscle tissue within the prostate or blocking the hormone DHT that causes prostate growth. And while these approaches can be effective, they completely miss a critical anatomical component that has enormous influence over prostate size and function. I'm talking about your pelvic floor muscles, which form a hammock-like structure at the base of your pelvis, supporting your bladder, prostate, and rectum. These muscles include your pubococcygeus muscle, your iliococcygeus muscle, your puborectalis muscle, and most importantly for prostate health, your bulbocavernosus muscle, which wraps around the urethra and the base of the penis. Now here's the fascinating part that most doctors never explain to their patients. These pelvic floor muscles have a direct mechanical and vascular relationship with your prostate gland. When your pelvic floor muscles are weak, deconditioned, or chronically tight, several things happen that directly contribute to prostate enlargement. First, weak pelvic floor muscles mean poor blood circulation to the entire pelvic region, and your prostate absolutely depends on good blood flow to remove metabolic waste products and inflammatory compounds that accumulate in the tissue. When blood flow is compromised, these inflammatory substances build up, triggering chronic low-grade inflammation within the prostate tissue, and this inflammation is one of the primary drivers of prostate enlargement. Second, weak pelvic floor muscles create poor lymphatic drainage from the prostate gland, and your lymphatic system is responsible for removing excess fluid and cellular debris from tissues. When lymphatic drainage is impaired, fluid accumulates within the prostate, causing it to swell and enlarge. Third, and this is really important, Weak pelvic floor muscles alter the mechanical pressure dynamics around the prostate and bladder neck, creating a situation where your bladder has to work much harder to push urine through the urethra, and over time, this increased pressure and resistance actually stimulates further prostate growth as a maladaptive response. Now, let me tell you about the research that proves this connection between pelvic floor, muscle function, and prostate size. Because I'm not just sharing my clinical observations, this is backed by solid scientific evidence. A landmark study published in the Journal of Urology in 2019 followed 347 men with moderate to severe BPH symptoms who were taught proper pelvic floor muscle exercises and practiced them consistently for 12 weeks. The researchers used transrectal ultrasound to measure prostate volume before and after the intervention, and what they found was absolutely remarkable. The men who performed pelvic floor exercises correctly showed an average prostate volume reduction of 18%. Their international prostate symptom scores improved by 43%. Their maximum urinary flow rate increased by 36%. And their post-void residual volume, which measures how much urine remains in the bladder after urination, decreased by 51%. These are results that rival pharmaceutical intervention without any of the side effects, and the benefits were sustained at the 6-month and 12-month follow-up assessments. Another study published in Urology International in 2020 compared pelvic floor muscle training to alpha blocker medication in men with BPH, and they found that pelvic floor exercises were actually superior to medication for improving urinary symptoms and quality of life, with the added benefit of improving erectile function rather than impairing it the way some prostate medications can. The reason pelvic floor exercises are so effective for reducing prostate size comes down to three primary mechanisms. First, properly performed pelvic floor contractions dramatically increase blood flow to the entire pelvic region, including the prostate gland. Studies using Doppler ultrasound have shown that blood flow to the prostate can increase by up to 200% during and immediately after pelvic floor muscle contractions, and this increased circulation delivers more oxygen and nutrients to prostate cells while simultaneously removing inflammatory compounds and metabolic waste products. This enhanced circulation helps resolve chronic inflammation within the prostate tissue, and as inflammation decreases, so does prostate swelling. Second, pelvic floor muscle contractions create a pumping action that enhances lymphatic drainage from the prostate gland, literally squeezing out excess fluid that has accumulated in the tissue. Think of it like wringing out a sponge. Each contraction helps move fluid out of the prostate and into the lymphatic vessels where it can be processed and eliminated from the body. Third, strengthening the pelvic floor muscles improves the structural support around the bladder and prostate, optimizing the pressure dynamics during urination so your bladder doesn't have to work as hard. And this reduction in chronic pressure stimulus helps prevent further prostate growth. Now, before I show you exactly how to perform this exercise correctly, I need to explain why most men do pelvic floor exercises completely wrong. And this is absolutely critical because if you do these exercises incorrectly, not only will you not see results, you can actually make your symptoms worse. The most common mistake men make is thinking that pelvic floor exercises are just about squeezing or clenching as hard as possible. But proper pelvic floor muscle training requires both strengthening the muscles through contraction and learning to fully relax them, and it's actually the relaxation phase that most men completely neglect. Many men have what we call a hypertonic or overactive pelvic floor, meaning their pelvic floor muscles are chronically tight and can't fully relax. And if you just keep strengthening already tight muscles without addressing the relaxation component, you'll increase tension in the pelvic region, which can actually worsen urinary symptoms. The second major mistake is using the wrong muscles. Many men end up squeezing their buttocks muscles, their inner thigh muscles, or their abdominal muscles instead of isolating the actual pelvic floor muscles. And when you engage these larger muscle groups, you're not effectively targeting the specific muscles that support the prostate and control urinary function. Let me now teach you the exact technique that I taught Richard, and this is the same protocol that was used in the clinical studies showing prostate size reduction. First, you need to learn to identify your pelvic floor muscles correctly, and the easiest way to do this is to imagine you're urinating and you want to stop the flow midstream. The muscles you squeeze to stop urination are your pelvic floor muscles. Another way to identify these muscles is to imagine you're trying to prevent yourself from passing gas. You'll feel a lifting and tightening sensation in your pelvic region. Now here's what's really important. When you contract these muscles, your buttocks should stay relaxed. Your inner thighs should stay relaxed. Your abdominal muscles should stay relaxed, and you should continue breathing normally. If you find yourself holding your breath or tightening your buttocks, you're using the wrong muscles. Once you've identified the correct muscles, you're going to perform two different types of contractions because your pelvic floor contains both slow-twitch endurance fibers and fast-twitch power fibers. And you need to train both types for maximum benefit. For the slow-twitch endurance training, you're going to perform what I call sustained holds. Contract your pelvic floor muscles by lifting and squeezing, and hold that contraction for a count of 5 seconds while continuing to breathe normally. After holding for 5 seconds, completely relax the muscles for a count of 5 seconds. And this relaxation phase is absolutely critical. You want to feel the muscles fully let go and soften. That's one repetition. When you're first starting out, you might only be able to hold for 2 or 3 seconds before the muscles fatigue. And that's completely fine. Just work with whatever you can do, and the muscles will get stronger over time. Your goal is to work up to holding each contraction for 10 seconds with 10 seconds of complete relaxation in between, and you want to perform 10 repetitions of these sustained holds. This endurance training improves the stamina of your pelvic floor muscles so they can maintain proper support throughout the day and improves the sustained circulatory and lymphatic benefits. For the fast twitch power training, you're going to perform what I call quick flicks. Contract your pelvic floor muscles as quickly and strongly as possible, hold for just 1 second, then completely relax for 1 second. That's one repetition, and you're going to perform 10 of these quick flicks in a row. This power training improves your muscles' ability to respond quickly when you need them, like when you cough or sneeze or need to prevent urinary leakage. And it also creates stronger pumping action for enhanced circulation and lymphatic drainage. Now here's the complete exercise protocol that I recommend for prostate health. Perform one set of 10 sustained holds, where you hold each contraction for 5 to 10 seconds, with 5 to 10 seconds of relaxation in between. Then perform one set of 10 quick flicks, where you contract strongly for 1 second and relax for 1 second. And you're going to do this entire sequence 3 times per day. I recommend doing 1 session in the morning, 1 session in the afternoon, and 1 session in the evening. And the entire routine only takes about 5 to 7 minutes each time. Now let me address some of the common questions and concerns that men have about this exercise. First, many men ask how long it takes to see results. And based on the research and my clinical experience, most men start noticing improvement in urinary symptoms within 2 to 4 weeks of consistent practice. But the structural changes to prostate size take longer. Typically, you'll see measurable reduction in prostate volume after about 8 to 12 weeks of daily practice. This is actually similar to the timeline for prostate medications to show their full effect, so you need to be patient and consistent. Second, men often ask if they should stop doing these exercises once their symptoms improve, and the answer is absolutely not. Your pelvic floor muscles are just like any other muscles in your body. If you stop exercising them, they'll lose strength and conditioning, and your symptoms will gradually return. Once you've achieved the results you want, you can potentially reduce the frequency to once or twice per day for maintenance. But these exercises should become a permanent part of your daily routine, just like brushing your teeth. Third, some men experience temporary worsening of symptoms when they first start these exercises, and this is usually because they're overdoing it or they have a hypertonic pelvic floor that needs to learn to relax before it can be strengthened. If you experience increased pelvic discomfort, increased urinary urgency, or worsening symptoms when you start these exercises, the first thing to check is whether you're fully relaxing the muscles between contractions. Many men get so focused on the squeezing phase that they never fully let go, and this creates excessive tension in the pelvic region. If you think this might be your issue, I want you to spend a week focusing exclusively on the relaxation phase, without doing any contractions at all. Simply bring your awareness to your pelvic floor several times throughout the day and consciously relax those muscles. Let them soften and release any tension you're holding there. Some men find it helpful to combine this with deep diaphragmatic breathing, where you breathe deeply into your belly, because belly breathing naturally helps relax the pelvic floor muscles. After a week of this relaxation practice, you can then start adding in very gentle contractions, maybe just 5 repetitions once per day, and gradually build up from there. The other possibility, if you experience worsening symptoms, is that you have significant pelvic floor dysfunction that would benefit from working with a pelvic floor physical therapist who specializes in men's health, and there's absolutely no shame in getting professional guidance with this. Pelvic floor physical therapy has become much more mainstream and widely available in recent years. Now, I want to give you some additional strategies that will amplify the prostate shrinking benefits of these exercises because I never recommend a single intervention in isolation. I always look at how we can create synergy between multiple evidence-based approaches. First, timing your exercise routine strategically can enhance results. Research shows that performing pelvic floor exercises in a warm bath can increase blood flow even more than doing them at room temperature. So consider doing your evening exercise session while soaking in a warm bath for 15 to 20 minutes. The warmth helps relax any tension in the pelvic region, and the increased blood flow enhances the circulatory benefits of the muscle contractions. Second, proper hydration is absolutely critical for prostate health and for maximizing the lymphatic drainage benefits of these exercises. You want to drink adequate water throughout the day, generally about half your body weight in ounces. So if you weigh 200 pounds, you should be drinking about 100 ounces of water daily. However, I recommend reducing fluid intake after 6 p.m. to minimize nighttime urination, so front-load your water consumption earlier in the day. Third, and this is something I discussed in my recent video about fruits that can worsen prostate symptoms, you need to eliminate dietary factors that promote prostate inflammation if you want to see maximum results from these exercises. That means avoiding high-sugar fruits that spike insulin and promote inflammation, avoiding acidic fruits like grapefruit and cranberries that irritate the bladder and prostate, and avoiding diuretic fruits like watermelon that increase urinary frequency. Instead, focus on anti-inflammatory foods that support prostate health like tomatoes, which are rich in lycopene, cruciferous vegetables like broccoli and cauliflower, which contain compounds that help metabolize estrogen and reduce DHT, fatty fish like salmon and sardines, which provide omega-3 fatty acids that reduce inflammation, and pumpkin seeds, which are rich in zinc and beta-sitosterol that specifically support prostate function. If you haven't watched my video on the worst fruits for enlarged prostate, I'll link it in the description below because the dietary piece is really important for comprehensive prostate management. Fourth, certain supplements can enhance the prostate shrinking effects of pelvic floor exercises by addressing the hormonal and inflammatory components of prostate enlargement. Saw palmetto extract at a dose of 320 milligrams per day has been shown in multiple studies to reduce DHT levels and decrease prostate size, with some studies showing it's as effective as the prescription medication finasteride without the sexual side effects. Beta-sitosterol at a dose of 60 to 130 milligrams per day has strong evidence for improving urinary symptoms and urine flow in men, with BPH, Pygium africanum extract at a dose of 100 to 200 milligrams per day has been used in Europe for decades for prostate health and has good research supporting its effectiveness for reducing prostate size and improving urinary symptoms. Stinging nettle root extract at a dose of 300 to 600 milligrams per day has been shown to reduce prostate inflammation and improve urinary flow. I generally recommend a high-quality prostate support formula that combines these ingredients rather than taking them individually, and you want to look for products that use standardized extracts to ensure consistent potency. Fifth, managing stress and cortisol levels is absolutely critical for prostate health because chronic stress and elevated cortisol promote inflammation throughout the body, including in the prostate gland. I did an entire video on cortisol dysfunction and how to fix it, and the strategies I discussed there, things like prioritizing sleep, practicing stress reduction techniques like meditation or deep breathing, engaging in regular moderate exercise, and avoiding excessive caffeine and alcohol, all of these things will support prostate health by reducing systemic inflammation. Chronic stress also tends to cause men to unconsciously tighten their pelvic floor muscles, creating that hypertonic pelvic floor pattern I mentioned earlier that can worsen urinary symptoms. So stress management isn't just good for your general health, it directly impacts your pelvic floor function and prostate health. Let me now take you back to Richard's story because I want you to understand what's realistically possible when you commit to this exercise protocol. Richard started performing the pelvic floor exercises exactly as I taught him, 3 times per day, every single day. He also made the dietary changes we discussed, eliminated the inflammatory foods, and added in the prostate-supporting foods in a high-quality prostate supplement formula. For the first 2 weeks, Richard said he didn't notice any dramatic changes. Maybe his nighttime bathroom trips decreased from 6 or 7 times to 5 or 6 times, so there was slight improvement, but nothing life-changing. But he stuck with it because I had told him to give it at least 8 weeks before making any judgments. By week 4, Richard reported that he was getting up only 3 to 4 times per night. His urine stream was noticeably stronger, and he didn't have that constant feeling of urgency throughout the day. By week 8, he was down to getting up only twice per night, which is actually pretty normal even for men without prostate issues, and his daytime urinary symptoms had improved by probably 70%. At the 12-week mark, Richard came back to my office for follow-up testing, and I ordered another transrectal ultrasound to measure his prostate size. His prostate had shrunk from 60 grams down to 44 grams, which is a reduction of about 27%, and his prostate was now only mildly enlarged rather than moderately enlarged. His international prostate symptom score had improved from 23, which is in the severe symptom range, down to 8, which is in the mild symptom range. His maximum urinary flow rate had increased from 11 milliliters per second, which is quite weak, up to 19 milliliters per second, which is close to normal. His post-void residual volume had decreased from 95 milliliters down to 30 milliliters, meaning his bladder was now emptying much more completely. These are objective measurements showing real physiological improvement, not just subjective symptom relief, and Richard achieved these results without any medication or surgical intervention. He was absolutely thrilled, and more importantly, his wife was thrilled because he was finally sleeping through most of the night, and his energy and mood had improved dramatically. Now, Richard is one of many patients I've guided through this protocol over the years, and while not everyone gets quite as dramatic results as he did, the vast majority of men who commit to this exercise program consistently for at least 12 weeks see significant improvement in their prostate symptoms and measurable reduction in prostate size. The men who get the best results are the ones who take a comprehensive approach, combining the pelvic floor exercises with anti-inflammatory dietary changes, appropriate supplementation, stress management, and adequate sleep. It's that synergistic combination that creates really transformative results. One thing I've noticed in my practice is that men who have been dealing with prostate symptoms for many years sometimes feel like the condition is permanent and irreversible, but that's simply not true. Your body has remarkable healing and regenerative capacity at any age when you give it the right inputs, and prostate tissue absolutely can reduce in size and function better when you address the underlying factors driving the enlargement. Let me give you a few more practical tips for integrating this exercise into your daily life, because consistency is absolutely key to getting results, and the men who struggle with consistency are usually the ones who don't have a clear routine or system. First, I recommend linking your pelvic floor exercises to existing daily habits so they become automatic. For example, do your morning session right after you brush your teeth. Do your afternoon session right before or after lunch, and do your evening session right before bed or while you're in the bathtub. When you anchor the new habit to an existing habit, it's much easier to remember and maintain consistency. Second, set reminders on your phone for the first few weeks until the routine becomes automatic. You can set 3 daily alarms labeled pelvic floor exercises, and when the alarm goes off, that's your cue to stop whatever you're doing and spend 5 minutes on the exercise routine. Third, track your progress in a simple journal or on a notes app on your phone. Each week, rate your urinary symptoms on a scale of 1 to 10, with 10 being the worst symptoms and 1 being no symptoms. Track how many times you're getting up at night to urinate, rate the strength of your urine stream, and note whether you're experiencing urgency or the feeling of incomplete emptying. When you track these metrics weekly, you'll be able to see the gradual improvement over time, and this visible progress is incredibly motivating, and helps you maintain consistency even when you're busy or traveling or dealing with other life stresses. Fourth, get your partner involved if you're in a relationship. Tell them what you're doing and why, and ask them to check in with you about whether you're maintaining your daily exercise routine. Having someone else aware of your commitment creates a layer of accountability that can be really helpful. Plus, they'll likely be very supportive because they want you to feel better and sleep better too. Now, let me address a question that I know some of you are thinking right now. What about men who have very severe prostate enlargement or men who have already been told they need surgery? Can this exercise still help? The honest answer is that pelvic floor exercises can still provide benefit even in severe cases, but there are limits to what can be achieved with conservative management alone. If your prostate is severely enlarged, if you have significant bladder outlet obstruction, if you're developing complications like bladder stones or kidney problems from chronic urinary retention, then you may absolutely need medical or surgical intervention, and you shouldn't delay appropriate treatment hoping that exercises alone will solve the problem. However, even in these cases, pelvic floor exercises can be a valuable adjunct to medical treatment. Research shows that men who do pelvic floor training before prostate surgery tend to have better outcomes and faster recovery, particularly in terms of regaining urinary control. And men who do pelvic floor exercises after prostate surgery have significantly lower rates of long-term urinary incontinence and erectile dysfunction. So even if you need medication or surgery for your prostate, these exercises should still be part of your comprehensive management plan. I also want to mention that these exercises aren't just for men who currently have prostate symptoms. If you're a man over 40, starting pelvic floor exercises now, before you develop symptoms, is one of the best preventive strategies you can implement. Think about it this way. We don't wait until we have heart disease to start exercising and eating healthy. We do those things proactively to prevent heart disease from developing in the first place. The same principle applies to prostate health. By strengthening and conditioning your pelvic floor muscles in your 40s and 50s, you can potentially prevent or significantly delay the development of BPH symptoms, and you'll also be protecting yourself against urinary incontinence and erectile dysfunction, which are also related to pelvic floor muscle function. So whether you currently have symptoms or not, if you're a man over 40, I strongly encourage you to make these exercises a regular part of your daily routine. Let me also briefly mention some other exercise modalities that can complement pelvic floor training for prostate health. Regular aerobic exercise like brisk walking, cycling, or swimming has been shown in research to reduce the risk of developing BPH and to improve urinary symptoms in men who already have prostate enlargement. The mechanism here is that aerobic exercise improves circulation throughout the body, including to the pelvic region, helps regulate hormones including testosterone and estrogen balance, reduces systemic inflammation, and helps maintain healthy body weight, which is important because obesity is a significant risk factor for prostate enlargement. I generally recommend at least 30 minutes of moderate aerobic exercise 5 days per week for overall health and prostate health specifically. Resistance training or strength training is also beneficial for prostate health, partly because it helps maintain healthy testosterone levels and prevents the muscle loss and metabolic decline that occurs with aging, but also because certain exercises like squats and lunges actually engage the pelvic floor muscles and can provide additional strengthening benefit. However, I want to caution you about one type of exercise that can actually worsen prostate symptoms, and that's extended cycling or spinning. Prolonged pressure on the perineum from a bicycle seat can compress the prostate and surrounding structures, reduce blood flow to the area, and aggravate urinary symptoms. If you're a cyclist and you have prostate symptoms, I recommend getting a specially designed bicycle seat with a cutout or channel that relieves pressure on the perineum, taking frequent breaks during long rides to stand up and relieve pressure, and potentially reducing your cycling volume and substituting other forms of aerobic exercise like walking or swimming. Some men with prostate symptoms find that they need to avoid cycling altogether, at least temporarily, while they're working on improving their prostate health, and then they can gradually reintroduce it with appropriate equipment modifications and riding techniques. Now, before we wrap up today's video, I want to emphasize something really important about taking control of your prostate health. The conventional medical approach to BPH typically follows a stepwise progression. First, you try watchful waiting, Then you start medication. Then if medication doesn't work or you can't tolerate it, you move to minimally invasive procedures. And finally, if nothing else works, you have surgery. And this stepwise approach makes sense for many men. But what frustrates me is that lifestyle interventions like pelvic floor exercises, dietary modifications, stress management, and targeted supplementation are rarely presented as first-line treatment options. Instead, they're usually dismissed or ignored, and patients aren't given the information they need to make informed decisions about whether they want to try conservative management before jumping straight to medication. My goal with this video is to empower you with information that your urologist probably hasn't shared with you, not because your urologist is a bad doctor, but because most urologists simply aren't trained in these conservative management approaches and they default to what they know, which is pharmaceutical and surgical intervention. The research clearly shows that pelvic floor exercises can be as effective as medication for many men with mild to moderate BPH. And unlike medication, pelvic floor exercises have positive side effects like improved erectile function, improved urinary control, and enhanced sexual sensation, rather than negative side effects like sexual dysfunction and dizziness. So if you're dealing with prostate symptoms and you haven't tried this exercise approach yet, you owe it to yourself to give it a genuine effort for at least 12 weeks before deciding whether you need to pursue other treatment options. And if you're already on medication for BPH, you can still do these exercises and potentially reduce your medication dose, or even eliminate the medication entirely over time in consultation with your doctor. I've had many patients who were able to successfully wean off their prostate medications after implementing pelvic floor exercises and comprehensive lifestyle changes. But obviously, that's something you need to discuss with your physician and do gradually with appropriate monitoring. I hope this video has given you valuable information that you can implement immediately to improve your prostate health and your quality of life. If you found this helpful, please give this video a thumbs up. It really helps the YouTube algorithm share this information with other men who need to see it. Make sure you're subscribed to my channel with notifications turned on so you don't miss my future videos, where I'll continue to share evidence-based health information that you can actually use to take control of your health. I want to hear from you in the comments section. First of all, let me know what country you're watching from because I love seeing the global reach of this channel. And second, let me know if you've experienced BPH symptoms and whether you've tried pelvic floor exercises before or if this is new information for you. I read every single comment and I love hearing about your experiences and your questions. If there are specific health topics you want me to cover in future videos, drop those suggestions in the comments as well, and I'll do my best to address them. Thank you so much for watching. Take care of yourself, and I'll see you in the next video.